Good morning and welcome to Monash News. Today we have some breaking news. A male in his mid-60s who wishes not to be shown on camera has come forward and shared with his struggles with us, suffering from emphysema. Today in store for you we have Dr. Rad, a pharmacist, and a few nurses to advise the public on the horrible disease and what it does to you, how it is treated, so stay tuned. 65-year-old truck driver who wishes to be kept unnamed has been smoking for up to 45 years, with a minimum of 2 packets a day. He spends a long 50 hours a week sitting in a truck, which is probably the cause of his excessive chain smoking. He is constantly experiencing shortness of breath, even while sedentary, with a constant cough, and episodes of chest tightness and pain. Now crossing over to Dr. Rad, who will explain to you the pathophysiology of emphysema.
Thanks, Anna. You're with Dr. Rad, and I'm here to explain what emphysema is. So we've got our lungs here. These are trachea, the bronchus, the bronchioles, and the alveoli. So the air comes through here and gets diffused into the lung. So what happens is, we've got a bit of a closer view for what an alveoli actually does. It diffuses the oxygen out into the bloodstream, and it brings the CO2 back in and diffuses that through the lungs. So what happens with emphysema is it gets distracted by things such as smoking, chemical pollutions, car pollutions, and our body releases macrophages, neutrophils, and lymphocytes, which release allostase, which actually destroys our alveoli in our lungs. So they lose their elasticity, they lose their walls, air gets trapped in the lungs and it can't be diffused out. What else happens? And because of that, there's other complications that happen. So with a person with emphysema, you'll see they might have chest infections, they'll have prolonged expiration, weight loss, barrel chest, and this is because the air gets trapped in the lungs, that the lungs actually expand. And here are your ribs, for example. Your lungs expand and your ribs actually become fixed in that position, and it actually becomes quite hard for you to use your normal muscles to breathe in and out, which is why you have prolonged expiration and also work of breathing and shortness of breath, because you're not getting enough oxygen, so your body is working extra hard to breathe to get that oxygen. So to go forward with all of this, why you would have chest pain is it's actually quite painful for somebody who's got chronic COPD and emphysema to breathe. So going forward, what might happen with some of the complications is you can get right ventricular failure. So you see your heart where your lungs is, whilst your lungs are getting bigger and working harder to get oxygen, you're at your right pulmonary, which would be your pulmonary vein or artery, or ventricular, sorry, works really hard to pump blood through your body because there is not enough oxygen. So there's bigger demand and your heart just eventually pumps till it becomes tired. You can get spontaneous pneumothorax, and that's actually just because there is air sacs where air can build up and your lungs will just collapse because there's air, one of these bursts, your air goes all into one place. You can get respiratory acidosis, and that's because there isn't a proper balance between the oxygen you're taking in and the CO2 you're taking out, because again, places where the gas exchange is happening are destroyed. And depression, obviously, because people with emphysema lose their ability to do normal day things. Walking is an effort, exercising is an effort. Even finishing a meal is an effort because they're working so hard to breathe, and that's basically emphysema. Now back to you.
Thanks, Dr. Rad. Very informative. Now crossing over to pharmacist Sarah, who will be advising you of the indications, actions, side effects, contraindications, and safety monitoring of all relevant medications to emphysema.
Thanks, Anna. I'm pharmacist Sarah, and I'll be explaining the medications that will help someone with emphysema. Bronchodilators are one of the main medications used in emphysema, and there's many different types. The first type we're going to talk about is xanthines. Xanthines are also known as hemifilling. Its indication is relief or prevention of bronchial and reversible bronchospasm associated with chronic bronchitis and emphysema. It directly acts on bronchial smooth muscle, causing bronchodilation and increasing capacity. It also inhibits the release of the SRSA and histamine. When taking this medication, it may have some side effects such as irritability, restlessness, loss of appetite, proteinuria, life-threatening arrhythmias, respiratory arrest, flushing, and fever. I wouldn't recommend taking this medication if you're breastfeeding and or pregnant. Some safety tips would be to monitor your response to make sure that you're not having any side effects, and monitor blood serum levels. The next medication we're talking about is sympathomedics, also known as salbutamol and Ventolin. This is used as a prophylaxis for bronchospasm and acute asthma attacks. It reacts to the A and B receptor sites in the sympathetic nervous system to cause bronchodilation. It also increases blood pressure, heart rate, and respiratory rate. Its side effects are tremors, gastrointestinal upset, tachycardia, dizziness, headaches, and some nervousness. I wouldn't recommend taking this medication if you're pregnant or breastfeeding. Some contraindications are aggravated by sympathetic stimulation, such as cardiac disease, diabetes, arrhythmias, and hypothyroidism. I wouldn't recommend using it if you're pregnant and or breastfeeding. Some safety risks would just be to monitor your vital signs closely to make sure that you're not having increased blood pressure, heart rate, or respiratory rate. The next one we're talking about is anticholinergics, such as Atrovan. They are used for acute asthma, chronic asthma, bronchospasm, and the common cold. It works by inhibiting cholinergic bronchomotor tone, bronchodilation, and blocks vagal reflexes that mediate bronchospasm. Its side effects are dizziness, headaches, fatigue, nervousness, dry mouth, sore throat, palpitations, and urinary retention. For safety reasons, we need to evaluate the urinary output to make sure that you're not in retention. Encourage people to avoid prior to taking the medication. Ensure adequate hydration, and give falls prevention education. These are some examples of inhalers that could be used with any of these medications. There are many different types, but we would recommend using a spacer to make sure that you get most of your medication and it's easier to administer. The next medication we're talking about is corticosteroids. The first type is a local corticosteroid. It's used to prevent asthma attacks. It decreases inflammation in the airways and increases the airflow and facilitates respiration in an airway narrowed by inflammation. Its side effects are sore throats, hoarseness, coughing, dry mouth, and mouth infections. It's contraindicated in allergies to soy nuts, not to be used in pregnancy or breastfeeding. It's not for emergency uses, it's a preventative medication only. Some safety aspects would be just to monitor your temperature for underlying infections, assess your vital signs regularly and your respiratory status regularly, and monitor for signs of respiratory infection. The next corticosteroid we're going to be talking about is a systemic corticosteroid, such as prednisolone. It's used in moderate to severe asthma attacks and to prevent asthma attacks. It suppresses the inflammatory genes which are activated in the lungs of an asthmatic. Its side effects would be delayed wound healing, adrenal insufficiency, Cushing's syndrome, headache, urinary retention, peptic ulcers, convulsions, cataracts, and arrhythmias. It's not to be used if you have osteoporosis, fungal infections, tuberculosis, measles, and chickenpox. Some safety aspects would be an ECG to monitor for arrhythmias and to monitor for convulsions and headaches. The last medication we're talking about is mucolytics. It's used as a treatment in bronchopulmonary disease with excessive or viscous mucus. It's also used in tracheostomy care. Its action is to reduce mucus viscosity by splitting bonds in mucoproteins. Its side effects are stomatitis, nausea, and bronchospasm. I wouldn't recommend using this medication if you have asthma, as it increases the risk of bronchospasm, and not to be used with cystic fibrosis.
Thanks, Zara. Now crossing over to Nurse Jasmine, who will be discussing the nursing considerations of emphysema.
Thanks, Anna. I'm Jasmine and I'm a nurse in the respiratory ward. Today I'll be talking to you about the nursing interventions that are relevant to patients with emphysema. The nursing interventions that may be used with patients diagnosed with emphysema may include impaired gas exchange. So impaired gas exchange can be defined as an excess or deficit in oxygenation and or carbon dioxide elimination at the alveolar capillary membrane. It can potentially be caused by the airways being obstructed by secretions, air being trapped, or alveoli being destroyed. Some signs and symptoms that the nurse should be looking out for include irritability, confusion, tongue discoloration, and restlessness. To do this, the nurse may check vital signs regularly. As a nurse, it would be required that the patient's vital signs would check regularly and that a baseline had been formed to use for comparative measures. A common sign of impaired gas exchange is an atypically rapid change in vital signs. High changes in blood pressure is a major sign of an abnormally low concentration of oxygen in the blood. Monitoring oxygen saturation via the use of a pulse oximeter allows the nurse to observe any significant oxygenation problems. Auscultating the lungs, crackles, wheezes, and any other abnormal lung sounds are a way of alerting the nurse about something potentially obstructing the patient's airways. The nurse should encourage normal daily activities. It is important to ensure that the patient is trying to participate in their normal daily activities because it is quite common for patients to no longer participate in these the way that they might have done so before. To do this, you would evaluate how much activity the patient is able to tolerate on their own and gradually increase this level of activity over time. The way in which the patient is positioned can influence the amount of oxygen that they are receiving and can increase or decrease respiration difficulties. To ensure that the patient is receiving an adequate amount of oxygen, it is important that they are in an upright position, as this reduces the level of effort involved in breathing and can reduce the chances of lungs collapsing. Thick excretions of sputum are one of the causes of impaired gas exchange, particularly in smaller airways. If getting the patient to cough regularly to try and excrete the sputum is proven to be ineffective, suctioning may be required to eliminate any sputum that may be blocking the airways. If the patient is finding that COPD is interfering with his daily life, you can refer him for pulmonary rehabilitation. Pulmonary rehabilitation can be defined as a multi-dimensional continuum of services directed to persons with a pulmonary disease and their families, usually by an interdisciplinary team of specialists with the goal of achieving and maintaining the individual's maximum level of independence and functioning in the community. This form of rehabilitation aims to increase the patient's ability to participate in physical and social activities, reduce the burden of disease, and improve quality of life for the patient. Another nursing intervention that may need to be addressed is imbalanced nutrition. Imbalanced nutrition refers to the patient not consuming an adequate supply of nutrients to meet the body's metabolic needs. It can be related to fatigue, the side effects of medication or vomiting, and the production of sputum. Imbalanced nutrition can be identified by weight loss, lack of interest in food, and may also reduce respiratory mass and strength, affecting muscle function. The nurse may auscultate bowel sounds, as an hypoactive bowel sound can identify constipation and a decreased gastric motility. This can be related to limited food intake, lack of nutrition, decreased physical activity, and a low concentration of oxygen in the blood. The nurse may limit gas-producing foods and carbonated drinks, as these products can cause abdominal pain and discomfort, which can in turn increase dyspnea and reduce the movement of the diaphragm. Assess dietary habits and monitor food intake. Many patients that are admitted with emphysema suffer from malnutrition, which can be due to respiratory insufficiency, causing a hypermetabolic state, which therefore increases the amount of calories that are required by the body. Providing oral care, respiratory difficulty can be increased by foul odours, which can lead to nausea and vomiting. This can make respiration extremely difficult and cause the patient a significant amount of discomfort. The nurse may also weigh the patient at regular intervals. It is important to determine what the ideal body weight is for the patient, taking into account his age and his height and trying to maintain him at an acceptable weight. As this patient is overweight, it will be making it harder for him to breathe and it may be requiring a conscious effort. By weighing him regularly, we can monitor any fluctuations in weight and manage these as necessary, as well as encouraging him to eat well and exercise to try and lose some weight also. The nurse may also administer oxygen during meal times, as this will increase the patient's energy while eating, which in turn will increase food consumption. This will also help in reducing any breathing difficulties. The last intervention that I'll be talking about is patient education. As a nurse, it is important to explain the individual disease process to the patient and encourage them to ask questions. This decreases anxiety and allows the patient to participate in their treatment plan. The nurse may also teach them breathing exercises. Pursed lip and abdominal or diaphragmatic breathing exercises strengthen muscles, can help minimise collapse of small airways and provide the individual with means to control dyspnea. The importance of oral care decreases bacterial growth in the mouth, which can lead to pulmonary infections. Reviewing harmful effects of smoking. Stopping smoking may slow the progression of COPD. When patients want to stop smoking, support groups and medical monitoring may be needed. The importance to follow up appointments. Monitoring disease processes allows for alterations in therapeutic regimen to meet changing needs and may help prevent complications. And finally, educating them on oxygen requirements and dosage and the safe use of medications reduces the risk of misuse, so too little or too much, which results in complications. This also promotes environmental and physical safety.
And lastly on our program tonight, we'd like to talk to you about National Safety and Quality Health Service Standards. We're going to talk about 3 standards. The first standard would be standard 4, medication safety. To maintain medication safety in hospitals, there are many different systems in place to reduce the likelihood of medication incidents. Some of these systems are the 7 rights to medication administration, right patient, right dose, right time, right route, right reason, and right documentation. There are policies and procedures that are put in place by the organisation that are related to all national standards to ensure that medications are given under the right circumstances for the right reasons. Documentation is a big part of giving any medication to make sure everyone is aware in any situation what the patient has been given and at what time. Education and communication is also very important, so that the patient and the person giving the medication can understand the use, options, risks, and responsibilities for taking the medication. There are regular assessments that go along with each medication that depend on what the medication is. The next standard we'll talk about is Standard 6, Clinical Handover. It is important to make sure that everyone is on the same page about the care of the patient and to make sure that he is the best care around. For our patient, we're going to use the ISBA. So, identification, he's a 65-year-old Caucasian male. Situation, he has consistent shortness of breath, even while sedentary, and a consistent cough with chest tightness, and 8 to 9 out of 10 pain. Background, he lives alone and spends long hours in his truck, about 50 hours per week. He's 6 foot with a weight of 120 kilos, has a poor diet and limited ambulation. Assessments, he's having blood tests with the results of increasing red blood cells due to lack of oxygen. And last but not least is recommendations. We would recommend him to have a chest x-ray to detect hyperexpansion of his lungs, which will cause overinflation, an ECG to rule out heart failure, and a HRCT to determine the type and extent of his emphysema. Now, the last standard I'd like to talk to you about is Standard 9, which is recognising and responding to clinical deterioration in an acute healthcare setting. Every health service clinician in the acute setting is given training to ensure that they are able to recognise and respond to the early signs of clinical deterioration. They would monitor vital signs for any changes, maintain their knowledge of any signs and symptoms of the deterioration of any condition, knowledge of the systems in the workplace to notify other staff members of any deteriorations, and communication skills, including to hand over to ensure everyone is aware of the details in any situation.
Thank you for tuning into Monash News and to our special guests on the show tonight, Dr. Rad, Pharmacist Sarah, and Nurse Jasmine. I'm Anissa Carlos, and good day.